Let's dive right in. Question 1. A client with COPD presents with severe dyspnea, O2 sat 82% on room air, accessory muscle use, and RR 34 per minute. What should the nurse do first? A. Apply 2 liters per minute oxygen. B. Place in high Fowler's position. C. Administer albuterol nebulizer. D. Notify the provider. Correct answer, B. Place in high Fowler's position. Rationale: positioning improves ventilation immediately before other interventions. Strategy: airway distress? Position first. Question 2. A client with septic shock has BP 7840, HR 132, warm skin, and lactate 5.2. Which intervention is priority? A. Draw repeat lactate. B. Give 4 normal saline bolus. C. Apply warming blanket. D. Give acetaminophen. Correct answer, B. Give 4 normal saline bolus. Rationale: fluid resuscitation reverses hypotension in early sepsis. Strategy: sepsis plus hypotension bolus fluids first. Question 3. A postoperative client becomes confused, restless, and has an O2 sat of 86%. What is the priority? A. Call rapid response. B. Increase oxygen. C. Reorient the client. D. Check blood glucose. Correct answer, B. Increase oxygen. Rationale: hypoxia is causing the altered mental status. Strategy: AIIMS plus low O2 equals give oxygen first. Question 4. A client with DKA arrives with fruity breath, Kussmaul respirations, glucose 690 mg per deciliter, and BP 90/56. What should the nurse do first? A. Start 4 insulin infusion. B. Give 1 LNS bolus. C. Give potassium supplement. D. Draw ABGs. Correct answer, B. Give 1 LNS bolus. Rationale: fluids come before insulin in DKA to restore perfusion. Strategy: DKA sequence, fluids insulin potassium. Question 5. A client receiving a blood transfusion reports chills, back pain, and dark urine. What should the nurse do first? A. Notify the provider. B. Stop the transfusion. C. Take vital signs. D. Flush the line with NS. Correct answer, B. Stop the transfusion. Rationale: classic hemolytic reaction, stop blood immediately. Strategy: reaction? Stop blood first. Question 6. A patient with heart failure presents with pink frothy sputum, O2 sat 78%, severe dyspnea, and bilateral crackles. What is the first action? A. Administer 4-furosemide. B. Place the client upright. C. Give nitroglycerin. D. Obtain ABGs. Correct answer, B. Place the client upright. Rationale: positioning improves oxygenation immediately. Strategy: airway distress position before medication. Question 7. A client with suspected stroke arrives with facial droop and slurred speech. Last known well, 25 minutes ago. Which action is priority? A. Give aspirin. B. Prepare for CT scan. C. Check blood sugar. D. Start 4 fluids. Correct answer, B. Prepare for CT scan. Rationale: must rule out hemorrhage before treatment. Strategy: stroke? CT first. Question 8. A client with acute pancreatitis has severe epigastric pain radiating to the back. BP 86/54. What should the nurse do first? A. Administer 4 opioids. B. Begin fluid resuscitation. C. Insert NG tube. D. Draw amylase/lipase. Correct answer, B. Begin fluid resuscitation. Rationale: hypovolemic shock risk in pancreatitis requires fluids first. Strategy: low BP? Fix perfusion first. Question 9. A patient with pneumonia becomes confused, RR 30, temp 40.1 degrees Celsius, and O2 sat 84%. What is the first action? A. Administer antipyretics. B. Start 4 antibiotics. C. Apply oxygen. D. Collect sputum culture. Correct answer, C. Apply oxygen. Rationale: hypoxia causes confusion. Correct O2 first. Strategy: O2 less than 90% oxygen immediately. Question 10. A client with chest pain shows ST elevation on ECG. What should the nurse do first? A. Give morphine. B. Give aspirin. C. Start nitroglycerin drip. D. Prepare for cath lab. Correct answer, B. Give aspirin. Rationale: aspirin reduces clot formation and improves survival. Strategy: STEMI. Aspirin first. Question 11. A client on warfarin has 9 Indian rupees and gum bleeding. What is the priority? A. Hold warfarin only. B. Give vitamin K. C. Check PTT. D. Apply pressure to gums. Correct answer, B. Give vitamin K. Rationale: high INR plus bleeding reverse anticoagulation. Strategy: critical INR vitamin K. Question 12. A client with meningitis has nuchal rigidity, photophobia, and petechiae. Which priority action? A. Start 4 antibiotics. B. Give acetaminophen. C. Prepare for CT scan. D. Keep NPO. Correct answer, A. Start 4 antibiotics. Rationale: meningitis is life-threatening, treat immediately. Strategy: suspected meningitis? Antibiotics ASAP. Question 13. A diabetic client is unconscious, trembling, and diaphoretic. First action? A. Start 4 dextrose. B. Check blood glucose. C. Call rapid response. D. Give IM glucagon. Correct answer, B. Check blood glucose. Rationale: must determine if hypoglycemia is the cause. Strategy: AIIMS in diabetic check glucose first. Question 14. A client with kidney failure has K plus 7.4 and peaked T waves. What should the nurse prepare to administer first? A. Sodium polystyrene. B. Insulin with glucose. C. Loop diuretics. D. Calcium gluconate. Correct answer, D. Calcium gluconate. Rationale: stabilizes heart in severe hyperkalemia. Strategy: K plus 7 stabilize heart before shifting potassium. Question 15. A trauma patient is tachycardic, hypotensive, cool, and pale. What is the priority? A. Apply warming blanket. B. Bolus 4 fluids. C. Draw CBC. D. Insert Foley catheter. Correct answer, B. Bolus 4 fluids. Rationale: classic signs of hypovolemic shock. Immediate fluids. Strategy: shock. Fluids first. Question 16. A client with asthma has silent chest and O2 sat 82%. Priority action? A. Administer albuterol. B. Prepare for intubation. C. Give 4 steroids. D. Apply oxygen. Correct answer, B. Prepare for intubation. Rationale: silent chest equals impending respiratory arrest. Strategy: no air movement. Prepare to intubate. Question 17. A post-op client suddenly develops tachycardia, chest pain, and dyspnea. Which is first? A. Call rapid response. B. Apply oxygen. C. Give anticoagulants. D. Start 4 fluids. Correct answer, B. Apply oxygen. Rationale: airway first in suspected PE. Strategy: SOB. Oxygen first. Question 18. A client with liver failure has hysterexis and confusion. What should the nurse give? A. Vitamin K. B. Lactulose. C. Albumin. D. 4 glucose. Correct answer, B. Lactulose. Rationale: removes ammonia, reducing encephalopathy. Strategy: confusion plus liver disease. Lactulose. Question 19. A patient receiving heparin develops platelets 45,000. What should the nurse do? A. Increase the dose. B. Stop heparin. C. Give aspirin. D. Start warfarin. Correct answer, B. Stop heparin. Rationale, low platelets indicate HIT. Strategy, low platelets plus heparin stop immediately. Question 20. A client with thyroid storm has HR 158, fever 40.0 degrees Celsius, and hypertension. What is the priority? A. Give methimazole. B. Apply cooling blanket. C. Administer beta blockers. D. Give 4 fluids. Correct answer, C. Administer beta blockers. Rationale, controls HR and prevents cardiovascular collapse. Strategy, thyroid storm beta blocker first. Question 21. A client with pneumonia is receiving vancomycin and develops flushing and hypotension. What should the nurse do? A. Stop infusion. B. Slow the infusion. C. Give antihistamines. D. Notify provider. Correct answer, B. Slow the infusion. Rationale, red man syndrome is not allergic, due to fast rate. Strategy, flushing plus vanco slow the rate. Question 22. A client with spinal cord injury C4 suddenly develops BP 220/112 and pounding headache. What is the priority? A. Give hydralazine. B. Check for bladder distension. C. Notify provider. D. Turn the client to the side. Correct answer, B. Check for bladder distension. Rationale, most common cause of autonomic dysreflexia. Strategy, high BP plus SCI remove noxious stimuli. Question 23. A client with pulmonary edema shows pink frothy sputum and severe dyspnea. First action? A. Start furosemide. B. Administer morphine. C. Apply oxygen. D. Prepare for intubation. Correct answer, C. Apply oxygen. Rationale, correct hypoxia immediately. Strategy, ABC's oxygen first. Question 24. A patient with neutropenia has temp 38.4 degrees Celsius. What is priority? A. Give acetaminophen. B. Start 4 antibiotics. C. Obtain sputum culture. D. Increase oral fluids. Correct answer, B. Start 4 antibiotics. Rationale, neutropenic fever equals medical emergency. Strategy, immunosuppressed plus fever antibiotics immediately. Question 25. A client with suspected GI bleed has BP 84/50 seconds, HR 128, melena stool. What is the first action? A. Start 4 normal saline. B. Give PPI. C. Prepare for endoscopy. D. Administer blood. Correct answer, A. Start 4 normal saline. Rationale, must stabilize BP before anything else. Strategy, low BP fluids first. Question 26. A client with hyperglycemia develops deep rapid respirations. What is this an indication of? A. Respiratory failure. B. Kussmaul respirations. C. Pulmonary embolism. D. Asthma attack. Correct answer, B. Kussmaul respirations. Rationale, seen in DKA for CO2 removal. Strategy, hyperglycemia plus deep breaths DKA. Question 27. A client with CHF gains 6 pounds in 2 days and has increased edema. What should the nurse do first? A. Restrict sodium. B. Notify provider. C. Assess lung sounds. D. Increase diuretics. Correct answer, C. Assess lung sounds. Rationale, weight gain indicates fluid overload. Assess breathing. Strategy, sudden weight gain check lungs. Question 28. A client taking metformin is scheduled for a CT scan with 4 contrast. What should the nurse do? A. Give the scheduled dose. B. Hold metformin before procedure. C. Increase fluid restriction. D. Give insulin instead. Correct answer, B. Hold metformin before procedure. Rationale: for contrast plus metformin risk of lactic acidosis. Strategy: contrast. Hold metformin. Question 29. A client on digoxin has nausea, blurred vision, and HR48. What should the nurse do? A. Give the digoxin dose. B. Check digoxin level. C. Give antiemetics. D. Encourage fluids. Correct answer: B. Check digoxin level. Rationale: symptoms indicate toxicity. Strategy: signs of toxicity, check level. Question 30. A dialysis patient reports tingling around the mouth and muscle cramps. What should the nurse assess first? A. Sodium. B. Calcium. C. Magnesium. D. Hemoglobin. Correct answer: B. Calcium. Rationale: hypocalcemia causes neuromuscular irritability. Strategy: Chvostek plus cramps, check calcium. Question 31. A client with pancreatitis has sudden decreased bowel sounds and increasing abdominal distension. What is the concern? A. Peritonitis. B. Paralytic ileus. C. Appendicitis. D. Rebound tenderness. Correct answer: B. Paralytic ileus. Rationale: pancreatitis often leads to ileus. Strategy: distension plus no sounds ileus. Question 32. A client with liver cirrhosis has ascites and SOB. What is the priority? A. Measure abdominal girth. B. Prepare for paracentesis. C. Give spironolactone. D. Restrict sodium. Correct answer: B. Prepare for paracentesis. Rationale: ascites compresses lungs, must relieve pressure. Strategy: SOB plus massive ascites paracentesis. Question 33. A patient with suspected MI has troponin 3.1 nanograms per milliliter. What is the priority action? A. Give aspirin. B. Give morphine. C. Start oxygen. D. Notify provider. Correct answer: A. Give aspirin. Rationale: aspirin reduces mortality. Strategy: MI labs positive aspirin. Question 34. A client with renal failure has confusion, nausea, and ammonia smell on breath. What should the nurse anticipate? A. Dialysis. B. Sodium bicarbonate. C. Insulin therapy. D. Blood transfusion. Correct answer: A. Dialysis. Rationale: uremia requires dialysis. Strategy: uremic symptoms. Dialysis. Question 35. A client with potassium 2.6 is on 4-digoxin. What is the priority? A. Give potassium supplement. B. Hold digoxin. C. Monitor urine output. D. Restrict sodium. Correct answer: B. Hold digoxin. Rationale: low K increases risk of fatal digoxin toxicity. Strategy: K less than 3 plus digoxin hold. Question 36. A patient with Addison's disease has BP 8240 and severe weakness. What should the nurse give? A. 4-dextrose. B. 4-hydrocortisone. C. Oral Florinef. D. Potassium supplements. Correct answer: B. 4-hydrocortisone. Rationale: Addisonian crisis corticosteroids. Strategy: crisis equals steroids first. Question 37. A client with peritonitis has rigid abdomen and fever. What should the nurse do first? A. Insert NG tube. B. Give 4 antibiotics. C. Administer pain meds. D. Give antiemetics. Correct answer: B. Give 4 antibiotics. Rationale: life-threatening infection, immediate antibiotics. Strategy: suspected peritonitis, antibiotics ASAP. Question 38. A client with atrial fibrillation has HR158 and dizziness. What is priority? A. Perform vagal maneuvers. B. Prepare for cardioversion. C. Administer beta blocker. D. Give heparin. Correct answer, C. Administer beta blocker. Rationale, control ventricular rate first. Strategy, AFib plus high HR slow HR first. Question 39. A client on chemotherapy has WBC 1000. What is priority teaching? A. Avoid fresh flowers. B. Increase protein intake. C. Walk daily. D. Increase fluid intake. Correct answer, A. Avoid fresh flowers. Rationale, neutropenia requires strict infection control. Strategy, WBC low protect from infection. Question 40. A burn patient suddenly becomes confused and restless. Which is priority? A. Increase opioid dose. B. Assess oxygen saturation. C. Check urine output. D. Reorient the client. Correct answer, B. Assess oxygen saturation. Rationale, smoke inhalation causes hypoxia. Strategy, burns plus AIIMS check oxygen first. Question 41. A patient treated with haloperidol develops fever and muscle rigidity. What is this? A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Dystonia. D. Akathisia. Correct answer, B. Neuroleptic malignant syndrome. Rationale, life-threatening reaction to antipsychotics. Strategy, fever plus rigidity NMS. Question 42. A patient with a new trach coughs up large amounts of bright red blood. What should the nurse do? A. Suction the tracheostomy. B. Call rapid response. C. Increase humidity. D. Apply pressure dressing. Correct answer, B. Call rapid response. Rationale, hemorrhage from trach equals emergency. Strategy, bright blood activate emergency team. Question 43. A client with MS has sudden inability to breathe deeply. What should the nurse assess? A. Speech clarity. B. Respiratory muscle strength. C. Reflexes. D. Ability to swallow. Correct answer, B. Respiratory muscle strength. Rationale, risk of respiratory failure. Strategy, MS plus breathing problem check respiratory muscles. Question 44. A client receiving TPN suddenly has chest pain and dyspnea. What is the priority? A. Stop TPN. B. Place in left Trendelenburg. C. Obtain chest X-ray. D. Flush the line. Correct answer, B. Place in left Trendelenburg. Rationale, prevents air embolism migration. Strategy, TPN plus sudden SOB air embolism position first. Question 45. A patient with appendicitis has increasing pain and rigid abdomen. What is priority? A. Give 4 morphine. B. Prepare for surgery. C. Start antibiotics. D. Apply ice pack. Correct answer, B. Prepare for surgery. Rationale, rigid abdomen indicates rupture surgical emergency. Strategy, suspected rupture immediate surgery. Question 46. A client with asthma has wheezing that suddenly stops. What is the concern? A. Improvement. B. Impending respiratory arrest. C. Normal finding. D. Fluid overload. Correct answer, B. Impending respiratory arrest. Rationale, silent chest means no airflow. Strategy, no wheeze plus asthma prepare for intubation. Question 47. A client with sickle cell crisis reports severe pain and chest tightness. Priority intervention? A. Give 4 fluids. B. Administer opioid analgesics. C. Apply warm compresses. D. Start oxygen. Correct answer, D. Start oxygen. Rationale, prevents further sickling. Strategy, sickle crisis oxygen first. Question 48. A patient on 4-nitroprusside becomes confused and hypotensive. Which lab should the nurse check? A. Potassium. B. Lactate level. C. Cyanide level. D. LFTs. Correct answer, C. Cyanide level. Rationale, nitroprusside can cause cyanide toxicity. Strategy, nitroprusside plus confusion suspect toxicity. Question 49. A client with pulmonary embolism begins coughing up blood. What should the nurse do first? A. Start 4 fluids. B. Apply oxygen. C. Prepare for thrombolytics. D. Check blood pressure. Correct answer, B. Apply oxygen. Rationale, treat hypoxia first. Strategy, hemoptysis plus P oxygen first. Question 50. A patient with severe dehydration has sodium 160, dry mucous membranes, and decreased LOC. What is priority? A. Give 0.45% NS. B. Give 3% NS. C. Restrict sodium. D. Administer diuretics. Correct answer, A. Give 0.45% NS. Rationale, hypernatremia hypotonic fluids. Strategy, NaHi use hypotonic fluids. Great job making it to the end. These 50 critical NCLEX case studies weren't easy, but every single one has prepared you for the high stakes thinking the real exam demands. Comment below. How many did you get right, and which question challenged you the most? I reply to every comment. If you found this helpful, don't forget to like, subscribe, and share so more nursing students can practice and pass their NCLEX with confidence. See you in the next video. And remember, you're not just studying to pass an exam, you're training to save lives.